Hey everybody, how you doing? Welcome back to another episode of Insurance Hacks with Kane Moston Insurance Agency. I'm Doug Cohen, and I am joined by Mr. Larry Silver today.
Good afternoon.
How you doing, Larry?
Hi, good.
Good to have you here. As a matter of fact, if you've seen the last few episodes, and if you haven't, you should, I've been on with Ben Clevenger, and now this is Larry's first episode. Larry is the Michael Jordan of Medicare.
I have been referred to that as that.
So we will adapt that moniker for the show because I like it, and we're going to talk about Medicare. And so today we're going to set up some of the basics because this is Larry's first episode. So let's talk Medicare 101 and some of the basics that you need to know. And we'll start really what we're going to talk about is what is Medicare, number one. Number two, when do you sign up for Medicare? And number three, what parts do you get? So having said that, let's start off with the basics, Larry, and just talk about what is Medicare.
So Medicare is a government health insurance program mostly for seniors age 65 and over, but there are some under age 65 people that are eligible for it. If you've been on Social Security disability for 2 years, you're eligible for Medicare, or if you have end-stage renal disease, kidney failure on dialysis, you're immediately eligible for Medicare. But for most people, think of Medicare as a 65 and older, but there are some exceptions to that.
And that's definitely something that I've learned. I mean, I just turned 50, so I've got a little time in theory before I have to think about this, but I did not know that there were instances where under 65 were eligible for Medicare.
Definitely.
And so let's talk about when, as you're approaching Medicare age, as you're approaching 65, when do you start thinking about this? When do you sign up for Medicare?
So the sign-up period for Medicare for somebody who's turning 65 begins 3 months before the month of which you turn 65, the month you're 65, and 3 months after. So you have that 7-month period that you can sign up for Medicare. If you're one of the people under age 65 that are on Social Security disability, after 24 months, your Medicare card gets sent to you automatically, nothing you need to do. But for most people with turning 65, it's a 7-month period where they sign up. There are 2 parts that the government gives you with Medicare. There's Part A, which covers things that are inpatient, like hospitalization, skilled nursing facilities, hospice. And there's also Part B, which are things that are outpatient, like office visits, MRIs, testing, blood work, that kind of stuff. And again, that sign-up period is that 7-month period. If you are receiving Social Security benefits, your Medicare card is sent to you automatically about 3 to 4 months before you turn 65. However, if you're not getting Social Security, you do need to enroll and sign up for Medicare on your own. It is not automatic, and you do not want to miss it because there are a lot of penalties and time-sensitive time frames where you need to make sure you sign up and get your coverage.
Well, and that, that's to your point. That's what you were saying earlier when we were talking about this before we started, is if you do miss that enrollment period, you're going to have to wait.
Correct. There's a open enrollment period for signing up for Medicare Part B, which most people don't even know about because they already get Part B. But if you miss that enrollment period, you have to wait till the following year. You could be waiting 16 or 17 months to get your insurance coverage. So it's very important that you know the time frames. I know the time frames. You contact me. We help you through it. There's no charge for our services. And I kind of guide you on the way of what you need to do to enroll. If you're currently you're working for an employer with under 20 employees, you still need to sign up for Medicare even if you want to stay on the group plan. Or maybe you have a spouse on the plan. If you are working for an employer with over 20 employees and you stay on the plan, you only need Part A. You don't need Part B, but there are some times where you don't even want Part A. So there are a lot of things involved in this.
Very important stuff. Well, and so let's talk about that a little bit more in terms of what parts do you get. Talk a little bit more about Part A and Part B and
Right.
Part D.
So Part A is given to you. It's free. There's no cost to it. For 99.9% of the people, you've earned the Part A for working throughout your career. Part B is not free. It does have a cost associated with it. Most people pay a base rate, but there are some people, higher income earners, that pay a higher rate than that. So if you don't need Part B because you're working for an employer with over 20 employees, you don't want to get Part B because you're paying for it. Part D is for prescription drug plans. They are done by private insurance companies, and whatever Part D you get really depends on which drugs that you take, and that's something that I would recommend for you based on your particular situation. And Part D premiums range from $7 a month to $109 a month. So it's important to work with somebody that knows the system and knows which plans would be best for you.
And I think to really wrap it up, that last sentence is one of the more important ones that you'll hear today is don't try to navigate all of this yourself.
Correct. When you're turning 65 and you're 6 months out, you're going to get mailings like you wouldn't believe from every insurance company that you've heard of and ones that you haven't heard of. And phone calls, you're going to get a lot of phone calls too. There's certain things that the people that call you can talk about, and there's certain things that they can't talk about. There are scrupulous people that do this, and there are unscrupulous people that do this. So it's important to work with somebody that knows this area inside and out, and that's somebody like me.
Larry's one of the scrupulous ones.
Yeah, absolutely. Thank you, Doug.
No problem, Larry. And that really, KMIagency.net, that's the new website. All the folks at Kane Moston Insurance Agency know what they're doing. We've been impressed. And you can contact them at the website, and you can follow on Facebook as well as LinkedIn. And there's a YouTube channel coming soon. So we're very excited about providing this information to you all. And I think this was a good base launching point to get into more detail as we go to talk a little bit more about Medicare, because there's a lot there. And so stick with us and you'll learn what you need to know. So thanks everybody for joining.
Thanks for watching.
And we'll see you on the next edition of Insurance Hacks with Kane Moston Insurance Agency. Take care, everybody.